There is no clapping and there's no response. This is the school board's meeting and it's not yours.
So as we all know, students benefit from in-person learning, and safely returning and remaining in school is our priority. As this new school year begins, there needs to be a continued focus on keeping students safe, since not all students will be eligible to be vaccinated before school starts. Variants have emerged that are increasing the risk of transmission and result in worsening illness to our younger people. At this point in the pandemic, given what we know about the low rates of in-school transmission when proper prevention measures are used, together with the availability of effective vaccines for those 12 years of age and up, it is vitally important for us all to take all the necessary measures to limit the community spread to ensure schools can be safe for all of our students, faculty, and teachers. Our interventions can greatly reduce the risk. All eligible individuals should receive the COVID-19 vaccine. Vaccination is currently the leading public health prevention strategy we have to end COVID-19 pandemic. The other prevention strategies for safe in-person learning recommended by CDC include universal indoor masking for all teachers, students, staff, and visitors to the school, regardless of vaccination status. CDC also recommends maintaining at least a 3-foot distance between students in the classroom. Hand washing, we know that hand washing, staying at home, getting tested, and contact tracing are also important layers of prevention to keep our schools safe. Again, we're emphasizing the implementation of layered prevention strategies, using multiple prevention strategies together consistently to protect those students and teachers that are not, and our staff not vaccinated, and as well as the members of their household. So where are we in Volusia County? We've had 51,812 reported cases of COVID since the beginning of this pandemic. 907 individuals have died, including 4 young people in their early 20s. There have been 3,095 cases in children between the ages of 5 and 14.
How many again between 5 and 14?
3,095.
Thank you.
We are seeing increased infection among our youngest. 820 school-age cases have been reported to us so far in the month of July. So let's go back. We've had 3,095 total since the beginning. Just in the month of July, we're not done with the month, we've had 820. Total cases from the beginning, which was March of 2020 to August 9th of 2020, so last year when we were talking, we had 544 reported cases in children under the age of 18. The state of Florida recently experienced a 61% increase in cases, jumping from 45,585 cases 2 weeks ago to 73,199 cases in the last 7 days. In Volusia County, cases have increased 75% during the same period, from 1,705 cases to 2,976 cases. So last week, almost 3,000 cases were reported to us. Our current 7-day average is 425, and the 14-day average of cases is 334. Our current 7-day positivity rate is 22.75%. And our 14-day average positivity rate is 20.54%. 4%. 96.5% of cases reported this month are within our unvaccinated population. The remaining 3.5 cases meet the criteria of a breakthrough case. This month, vaccinated residents are nearly 20 times less likely to become infected with COVID than the unvaccinated residents. So to put that in an attack rate, unvaccinated attack rate is 81 per 100,000 population. Vaccinated attack rate is 1,662 per 100,000 population.
Okay, go back and state your percentage again on that. You said this month vaccinated residents are, what was your percentage?
96.5% of the cases with the unvaccinated.
I
The
got
vaccinated was 3.5%.
3.5%?
We are seeing an increase in infections among younger residents. The average age of an unvaccinated case reported this month is 39 years of age. The vaccinated case average is 63 years old. Presently, 54% of Volusia County's eligible population is vaccinated. That means they've received at least one dose. 89% of our residents that are 65 and older are vaccinated. Only 15% of children aged 12 to 4 are vaccinated, and 24% of our 15 to 19-year-olds are vaccinated. Our most recent report indicated...
Ms. Boswell, could you say that one more time? You said 15% of what
12,
age?
12 to 14-year-olds.
12 to 14.
And what did you say about the younger group?
15 to 19-year-olds, or 24% of them are vaccinated.
Do you have, is this typed out or is this handwritten, what you're reading?
Typed.
Hmm?
Typed.
Is there any way we can have a copy of it? Because each time that you come, Ms. Boswell, you read this data and you read it very quickly, and we're caught having to try to capture it and write it down so that we can have a discussion about it.
You'll receive I'll send Dr. Fritz a summary tomorrow,
Sure.
if that's acceptable. Okay. Our most recent report indicated that 3,323 individuals residing in Volusia were vaccinated during the week of July 16th to the 22nd. So in the last week that we had a report of the number of people getting a vaccine, 3,300
That's Volusia County?
in Volusia County. We are currently investigating 58 active outbreaks, 30 of which are in our long-term care facilities, 6 are in our summer camps. There's other outbreaks, of course, happening in businesses, church groups, and other settings. I'm particularly concerned about our long-term care residents at this point with the number of outbreaks that we're seeing and the fact that immunity wanes as you age. So they continue to be our most vulnerable. So I want to end by just saying the presence of these variants and the large number of unvaccinated residents, the substantial community transmission, those are the factors that's contributing to it. So when you think about substantial community transmission, the definition is 100 per 100,000. We're at 545 per 100,000.
Thank you. Are there any questions from the board? Mr. Colon.
So is it the position of the Florida Department of Health as a body that we follow the CDC recommendations, or is that something that locally your department feels is, because as we know, there's a lot of pressure from the government right now as it relates to this topic, and so is this the conversation that's being had across the state that's going to be applied basically are the same recommendation to most of the districts who are in a similar situation? Or is this a Volusia County summary that you feel is appropriate?
This is a Volusia County summary.
Okay, so the Florida.
But I will say that our Surgeon General has said that we should be following CDC recommendations and the American Academy of Pediatrics, and their recommendation is universal masking in schools.
So since this surge, has there been any direction from the, because this surge came, you know, when we spoke about masks the last time, we were at 3.nothing%, which is when we made that decision. However, has there been a position or any statement, and I realize we're only 10 days into this last surge, has there been any position from the Florida Department of Health formally to make these recommendations?
Other than the Surgeon General saying on a call this week to follow the CDC guidance and the American Academy of Pediatrics.
Is that in writing anywhere that we're aware of?
It was on a call.
Great, thank you. That's all I have. Thank you.
Thank you, Mr. Clone. Ms. Burnett?
Thank you. When you talk about the cases, when they were testing, is it the point of care testing or is it the 3-day testing?
Antigen and PCR tests are both reported to the Department of Health.
Was there a recent study that stated that the PCR testing was giving false positives?
I didn't bring any of the rates in terms of the,
Okay.
false positive rates for that.
Okay.
I'm sorry, I didn't
That's
bring
all
that
right.
with me.
And how do they test for the variant?
It's sequencing testing that's being done at labs throughout the nation, and CDC is leading.
So most of the positives right now are the variant, or are they mixed?
So up to probably a week ago, it was the UK variant that was the predominant variant. That was really what we were seeing in the cases, and that's now changing, where the Delta variant is not quite the predominant, but it appears that that's a real risk for us because it's more transmission, higher transmission.
Okay. How many hospitalizations for pediatrics?
Okay.
And their age group, please.
Okay. I think this month, and I want to make sure I get it right. All right, so hospitalizations for the year of 2021, we've had, let's see, 25.
And what age group was that?
That's 19 and under.
19 and under.
And did you want it for the year or for the month of July? As
If
far
you
as
have it
the
for the month
breakdown?
of July, that would be great as well.
Okay, so the breakdown for the month of July, where we had 6 hospitalizations, we had 2 under the age of 1. We had 1 in the ages of 5 to 9. We've had 2 in the ages of 12 to 14. We have 1 in the ages of 15 to 19, which gets you to the 6. Now, there's something about hospitalizations you need to understand. That is just what we're aware of. Okay, so we may not have a complete picture of hospitalizations, and we certainly don't have a complete picture when it comes to recent hospitalizations. So as of today, what's been reported to us are those 6 hospitalizations. I will caution that that's probably a low number.
Thank you.
Okay.
And one thing to know about the numbers, like we had yesterday 536 new cases reported to us. The impact on the hospitals is 2 weeks out.
I'm sorry. I did have one more question, too. I apologize. You mentioned that you had 6 cases in summer camps. When you did the...
6 outbreaks.
6, oh, okay, 6 outbreaks.
6 outbreaks and 6, there were 6 summer camps that experienced outbreaks.
How many of the kids had were positive in those 6 outbreaks?
I didn't bring that. I just brought the outbreak information.
So do you know by the the tracing, they were all related to the summer camp, or did they get it from home, or how did we trace those?
So basically, a case is reported, and when the case investigation happens, we find out that kind of information, what kinds of activities and places that particular case has been engaged in during their infectious period, and it's linked back to the fact that they were working in a long-term care facility at the time. They're working in a summer camp. They're working in a daycare. And then we begin to see reports coming from other cases that are also in that same facility during that period of time. So when we have 2 cases or more in a facility, a congregate facility of that nature, it's considered an outbreak. We see a lot of that in the jail. Usually the jails are listed on the outbreak list on a pretty regular basis.
Thank you.
Ms. Haynes?
Good evening, Mrs. Boswell.
Good evening.
So I want to piggyback off of part of what Mrs. Burnett just said and what you responded to her. So you said we have currently 6 outbreaks across the entire Volusia County that have taken place in summer camps, correct?
Today.
Today. Okay. You said an outbreak is it's considered an outbreak as long as it's 2 people?
In a congregate setting.
Okay, so it could be 2 people out of a total of 5 people. It could be 2 people out of 300 students that are there, correct? So it's an outbreak if there's 2, regardless of how many people.
2 or more.
2 or more.
Mm-hmm.
All right. So when you were here in March, and you can correct me if I'm wrong, but when asked about the number of individuals, whether they were adults in the school setting, staff or students, if I remember correctly, you said under contact tracing, you could only trace back the possibility that 34 individuals may have come into contact with it in the school setting. And of those 34, only 4 were possibly traced back to sports, correct?
Possibly, but
Okay. And when I asked you about what was the criteria at that time that we should have been following for sports, you read me off a list that said students should have been masked while playing sports and all of that. And we talked about the fact that none of our students were masked for sports. They played football, they played basketball, they played baseball, they did wrestling, they did all of that. Nobody was masked, and we could maybe, for the entire district, for the whole last school year, all the way from August to March, only possibly trace back 4 students, 4 individuals, so it could have been a coach, could have come into contact with it at school playing sports. Here's where I'm at tonight. I heard you make a comment about the virus is waning in older ages. So let's talk about this virus.
the effectiveness of the vaccine. I'm sorry.
The effectiveness of the vaccine. So let's talk about COVID from when it started. Because COVID actually came into the United States, if you look at research, in the fall of 2018. It was approximately February of 2019 when the United States government identified principal investigative research doctors to start researching it, and companies such as Pfizer and Moderna and Johnson & Johnson started on a vaccine. My question to you tonight, I have a lot of questions for you, so I apologize, Ms. Cuthbert, but please bear with me, okay? My first question to you tonight is, here in DeLand, we have our own clinical research facility. We have 2 certified principal investigative research doctors that are involved with that. They started researching this in February of 2019. I have been in direct contact with them from the time we sent students home that spring break in March. I have had long conversations with them. I have seen the research that they've done. My question to you is, have you spoken to any of the doctors or researchers involved here in DeLand locally? They were selected as the first group out of Florida to do the research on COVID and to administer the Pfizer and Moderna shots. They are now doing the antibodies. Have you had any communication with them?
No.
Okay. So, can you describe for me the difference in symptoms and what happened to an individual that contracted the original COVID versus the UK COVID versus the Delta variant? Do you know the difference in the symptoms or what it did to individuals' bodies?
It depends on the individual.
Okay, do you know any of the signs, though, of the original COVID and what it did?
The symptoms that people, they were coughing, sneezing, sore throats, headaches, fatigue, diarrhea.
Okay, when people were first hospitalized with that, what was the immediate response that most hospitals, what did they do first?
They had difficulty breathing, so they were looking at the oxygen levels.
Okay, and what did they kind of jump to if they were struggling with breathing?
Well, incubating in the vent.
Okay, so research on venting individuals. Whenever you go to the point that you vent someone, you basically have reached a point where a ventilator is going to harden their lungs, and it's not necessarily going to make it better. I happen to have spoken also with local respiratory therapists, as well as some respiratory therapists, actually a head of respiratory therapy out of another state. And this is what they said to me. The first inclination of what we were told was to vent people. What we quickly learned is that in the original virus, the mucus was heavy and thick. And by venting someone, you basically were pushing them to the point that they may not recover because of what a ventilator does, and also because that heavy, thick mucus then blocked their lungs and made it difficult to breathe. So what they quickly learned, and why we took a turnaround and then stopped seeing as much ventilating going on, was they learned you've got to thin the mucus out and keep it going and not vent, and that's how we turn people around. What do you know about the symptoms right now for the UK variant or the Delta variant?
They tend to be more severe. So people, the Delta, they're going into the hospital much more sicker.
That's interesting, because in speaking with these research doctors that are local here, what they've said to me is they tend to mirror a cold or a sinus infection. The mucus is not as heavy in the Delta variant at this time as what it was in the original variant, because it's a mutated piece. It's no different than when the flu mutates. Like all of a sudden we'll get a very bad flu virus one year, and then the next few years we've got mutated viruses off of that are never as strong. They're always weaker. And you realize they build the flu vaccine each year off of the variant from that year and give it to people for the next year, not knowing what the variant's going to be. So here's where I'm at on this. We already chose for masks to be optional. I'm not changing my mind because, number one, children do not belong to us. We may have children. I have grandchildren, okay? But the medical decisions for my own children when they were of school age and for my grandchildren at this time belong to the right of their parents. Parents, I'm not in the position to make medical decisions and to enforce medical decisions upon children. So by making masks optional, we've given every parent out there, every staff member, and every student the right to make the choice that is best for them. So I'm standing by that. American Academy of Pediatrics, who's their #1 funder? Do you know?
No.
Let's try Pfizer. So here's what I've learned. Didn't want to get into all of this, but I've learned, and I'm researching, and I'm continuing to ask questions of those people that are dealing with this and tracking this on a daily basis. What I want to ask you about is, not once does anybody ever talk about antibodies. Do you know where we stand with the individuals that have already had COVID and where their antibodies are?
There is some CDC information out there. That's my source. That is suggesting that over time, your immunity may wane if you've had a prior infection, and there are cases where people have been infected for a second time.
Okay, so, all right, you opened that. So yes, I happen to have talked to the researchers that are local here that have been tracking people since February of 2019 who got the original case of COVID. We are now a year and a half out, and those individuals still have antibodies. I have personally a 78-year-old mother and a 79-year-old father who last August got COVID, and I have their permission to share this information tonight. They have been tested 4 times since then, checking their antibodies, and their antibodies are still strong. So what has their doctor told them? There is no need for you to take the vaccine because the vaccine's not going to give you anything that you already don't have naturally in your body. So how come we're never talking about the people that have already experienced it and the antibodies that they have? Like, there's no discussion about antibodies. And I'm sorry, but naturally, antibodies, I'd much rather have antibodies because I took it. I mean, why do we draw people's blood at other times to make sure they still have antibodies to if they'd had chicken pox or if they took the MMR? We don't automatically demand everybody be vaccinated. We draw their blood to find out what they still have. So when you said the vaccinate is waning in the older, who was the first group that we vaccinated here?
Our older folks.
Okay, so explain waning.
So there is some evidence that the immunity of some of our older adults may wane from the vaccine, and they may not have the level of protection, and that's the discussion that's happening around boosters right now.
Okay, so let's go back to this. Do you have any research that shows that if you because you talked also at one point about one shot of the vaccination, where we know if it's Pfizer or Moderna, it takes 2 shots. Only J&J, Johnson & Johnson, is a 1 shot. Do you have any research or data that tells you if everyone that was vaccinated, whether they took the Johnson & Johnson, the first shot of Pfizer or Moderna, or both shots, did they all develop antibodies?
Do I have that for the people that we vaccinated? No, I don't have that, but that's what you're expecting.
You're expecting.
Sure.
Would you like to know what the real numbers are? Nationwide, for the research that's being done in every state that is fed into one database, shows actually that everyone that was fully vaccinated, approximately 15% of them develop no antibodies. But yet, if they are carrying around a card and says they're vaccinated, we're good to go, right? But if we've had COVID and we have antibodies, whether we're 6 months out or a year and a half, we don't want to talk about it. We want you to take the vaccine. Okay, do you know what the research says right now for how long the antibodies are lasting in the individuals that have been vaccinated?
No.
3 months for some, 6 months for others, and they're still following on. All right, my question here to you tonight, because obviously, you're going to quote the CDC guidelines. I'm doing research, I'm asking questions, and I'm getting the research directly from people following all of this. When we were still in school, we had precautions. And you know what I think of the masks, because at the elementary level, some of those masks were absolutely filthy that those children were wearing. Now let me go back and ask another question. Do you know what the numbers are in the 0 to 19 or 0 to 25 age category of children this past year that lost their life due to pneumonia, not COVID-19, pneumonia?
No, I don't have that with me.
Okay, so I have it, and I can share it with you and email it to you. It's a whole lot more than what your COVID numbers are. More children died this past year of pneumonia. In previous years, more children have died of flu than they have of COVID. How many children have died in Volusia County of COVID?
None.
None. Correct. What's happening right now? Let's think about this. We've been an open state, and the entire world's been coming to Florida to summer vacation. Our beaches are full, our amusement parks are full, families are here together because they can be here together and there's no restrictions. Kids are at summer camps, kids are going to youth camps, kids are hanging out. And guess what kids are doing? Because this is what children do. Children hug, they touch each other, they hold each other's hands. We got teenagers out there kissing. Teenagers were kissing even during the school year when we made them wear a mask, but trust me, they took it off and they were kissing. But kids during the summer share food. Mom cuts up a watermelon, sticks it in a bowl, and they all reach in and touch it, and they share food. They share drinks. I mean, I got a 2-year-old and 4-year-old. The 2-year-old picks up the 4-year-old's cup all the time, thinking he has something better to drink than what she has, and he takes a drink out of it. Right now, we're not comparing apples to apples. So my next question for you is this. The numbers that you sent in the report over to Dr. Fritz and said, here's where our positivity rate is. The way you calculate the positivity rate, and I'm going to make it just very simple, is, so if last year we had 1,000 people, like this week in July, that were tested, and 50 of them were positive, that's how you calculate your positivity rate. Well, if this week in July, this year, only 100 take the test, and still 40 of them show up, all of a sudden our positivity rate's way up here because a lot less people got tested. Because that's how you calculate positivity rate. So positivity rates don't mean anything. What means something is last year, if you say to me, last year on this date, Ms. Haynes, there were 72 positive cases, people that tested positive. And you tell me there's 172 this year, then yeah, I've got to wake up and look. But your positivity rates are based on how many people test versus how many test positive. Less people are testing. And we've also talked about them having to test and retest and retest. And look, I appreciate what you do, but the bottom line is, if we've got right here in DeLand doctors that have been researching this and involved with updating the research, and they're tracking people for 3 years right now. Because remember, this is still not approved. This is still under an emergency order, okay? Why is it still under an emergency order? Because we don't have enough data on it. We don't know the long-term side effects. We don't know how long will you get antibodies? How long will your antibodies last? Now, I can tell you, if you got it, if you've already had COVID, you're truly in better shape than anybody else because you've got antibodies.
Except for the 907 individuals who've lost their lives.
Okay, I don't want anyone to lose their life, but the reality is every day someone loses their life. People lose their life due to cancer. People lose their life due to so many contributing or comorbidity factors. We don't live a single day that someone doesn't lose their life. Answer by saying that, were the flu deaths larger than what COVID's been?
Not this past year.
Okay, no. The year before, were they larger than what?
Yeah,
Because we're labeling everything COVID that we can label COVID because there's money attached to it. So were the flu deaths the year previous to COVID coming out higher than the COVID deaths?
I don't have that number with me.
They were higher. And I'm telling you that this year alone, the deaths to pneumonia were higher. And you know what strikes me interesting about pneumonia? I had pneumonia 6 years ago. It was one of the worst things that I lived through. But here's what's interesting. Nobody said I had to take the pneumonia shot. Nobody said, you've had pneumonia, or wait, all of us could get pneumonia. You've got to take the pneumonia shot because you're not going to live through pneumonia. So thank you very much. Thank you for coming. Thank you for being gracious and kind. Thank you for answering my questions. But You know, when this all started, we were told, stay home, don't go out, don't talk to anybody, don't have contact, don't hug anybody, don't kiss anybody, and we'll flatten the curve if we stayed home. Well, we stayed home and we didn't flatten the curve. Then we were told, now you all need to mask up, stay 6 feet away, you know, quarantine, all that. We didn't do it. Last year, one of my schools quarantined the entire 7th grade twice because you told them to. And each time you told them, they had to send every 7th grade child home from that school. The first time was 14 days. The next time was 10 days. It was due to an adult that, and if you remember, at least I remember, when we started this process, you said, if you put them in seating charts and they wear masks, and no one that tests positive is in their space less than 3 feet for 15 minutes, longer than 15 minutes, those kids won't have to quarantine. Well, my question was this. Typically, a 7th grade class period lasts 45 minutes. So I really struggled with how a single teacher in that room, because I went to the rooms, with the kids spread out, sitting behind plexiglass shields, wearing masks, that the entire 7th grade had to go home, because I couldn't figure out how that teacher, and before it was, if they had masks off, I couldn't figure out how that teacher spent 15 minutes or more in close proximity to every one of those kids. And I followed up, and not a single one of those children ever got sick during both of those times. So they missed 24 days of instruction. Prior to this past year, when a kid misses 5 days, parents are given a warning. When a student hits 10, they're given the second warning. At 15 days, they receive a letter stating they may have to appear before a judge because their child's not in school. No, I'm not accepting responsibilities. You and your team sent some of our kids home last year, and they missed 40 to 48 days of school. We're not under an emergency order anymore. In my opinion, if they're out 5, they're going to get notified. If they're out 10, they're going to get a warning. At 15, they're getting a letter home. So how can we be the ones sending them home? What I want to say to parents is this, as we've always done. If your child is sick, please do not send them to school. If you, as an adult, work in a school system, please do not come to work sick, okay? I believe if we do that, if we continue to say, you want to wear a mask, you want to wear a mask and a face shield, please do so. As long as we continue to stock soap, paper towels, hand sanitizer, and we continue on the path that we've done with these kids about washing their hands, not touching their face, not putting their fingers in their mouth. If we continue on the path of them not sharing food, not sharing drinks, wiping off their desk area, wiping off tables where they've been, we're going to be fine. And if they get sick, they're going to go home. Because you just told me, we've not lost a child, which is a blessing. Because I've never known a year that we've not lost a child to something. Because we've lost children in so many things. So thank you for coming tonight, but I'd like to suggest you may want to reach out to our local research facility that's here in DeLand and have some conversations with medical doctors that not only have medical degrees and practice as doctors, but they've gone on and taken the additional coursework and everything to be certified to be principal investigative research doctors. And they've been doing research now for probably a minimum of 15 to 20 years. They're located here in DeLand, and they are a part of this nationwide project doing all of this research, and they have access nationwide to tell you where we're at. And the last time I spoke to one of them, they said, actually nationwide, We've had less than 600 children. And when I say children, I have to preface the age they told me, 0 to 24, okay? And let me tell you, what young 20-year-olds are doing is a whole different thing than what little people are doing, all right? That have died where it has been coded as COVID as part of one of the things. But when you break it down, you have to look at the comorbidities and what contributed to that, because there's not very many, if any, that can be strictly a straight COVID death. Thank you.
Thank you.
Thank you, Ms. Haynes. That will not, I'm sorry. I asked you in the very beginning of the meeting. There is no clapping and there's no response. This is the school board's meeting, it is not yours. We will not know. Ms. Newman? No. This is our board meeting. This is the school board's meeting. You are invited. We meet in the sunshine. You are invited in. We are not going to discuss this. Ms. Haynes spoke her mind. She is a board member. She represents District 1. She has every right to say what she has as an elected official. We will not have this hijacking of our meeting. We will not have it. If you would like to say anything, please say it to the media outside, but not in here. There will be no clapping. There will be no response. You have public participation for that measure. Thank you. Mr. Persis, excuse me.